Today we will learn about brachial plexus. Brachial plexus is formed by the anterior primary rami of C5, C6, C7, C8 and T1 spinal nerves. It constitutes the roots, trunks, divisions, cord and branches. The C5 and C6 root combines to form the upper trunk. This upper trunk divides into two divisions, the ventral and dorsal division. The ventral divisions of upper and middle tongue combines to form the lateral cord. The dorsal divisions of the upper, middle and lower trunk combines to form the posterior cord, and a ventral division of lower trunk combines to form a middle cord. This lateral, posterior and a middle cord divides into branches, and there is a mnemonic to remember the names of branches. And for the lateral cord, it is the LML. L stands for the lateral root of median nerve. Combining with the medial root of the median nerve forms the trunk of the medial nerve. M stands for musculocutaneous nerve, supplying the three muscles of our brachium, which we can call as the arm region. They are the coracobrachialis, bicep brachii, and a brachialis muscle. Lateral pectoral nerve supplies the two muscles of our pectoral region, pectoralis major and the pectoralis minor. A mnemonic to remember the branches of the medial cord, they are M4U. M stands for medial pectoral nerve, supplying the pectoralis major and the pectoralis minor. Medial cutaneous nerve of arm carries the sensory impulse from the medial aspect of the arm. Medial cutaneous nerve of the forearm carries the sensory impulse from the medial aspect of the forearm. Medial root of the median nerve combines with the lateral root of the median nerve to form the trunk of the median nerve, which supplies the muscles of the forearm and the muscles of the hand region. Ulnar nerve supplies the medial head of the flexure digitorum profundus, flexure carpi ulnaris, the intrinsic muscles of the hand region. The mnemonic to remember the branches of the posterior cord are ulnar. U stands for upper subscapular nerve, supplying the subscapularis muscle. L for lower subscapular nerve, supplying the teres major muscle. And now to latissimus dorsi. The another name is thoracodorsal nerve, supplying the latissimus dorsi. Axillary nerve, supplying the deltoid and teres minor. Radial nerve, supplying the lateral, medial and the long head of bicep brachii. The 12 muscles of back of forearm, they are extensor carpi radialis longus, extensor carpi radialis brevis, extensor digitorum, extensor carpi ulnaris, supinator, anconeus, extensor indicis, extensor digiti minimi. Three muscles of our anatomical nerve box, they are abductor pollicis longus, extensor pollicis brevis and extensor pollicis longus. Certain branches also originate from the cords of the brachial plexus, from the roots of the brachial plexus. They are the long thoracic nerve, which originates from the roots, that they are C5, C6 and C7, supplying the serratus anterior, and two nerves also originates directly from the upper trunk of the brachial plexus. They are the suprascapular nerve, supplying the supraspinatus and infraspinatus muscle. Now to subclavius, supplying the subclavius muscle. Now clinical anatomy regarding to the brachial plexus. Before we are discussing about the clinical anatomy, let's talk about erbs point. Erbs point is formed by meeting of 6 different nerves: suprascapular, nerve to subclavius, two divisions, a ventral and a dorsal division, two roots, they are the C5 and C6 root, which forms the erbs point. Injury to the upper trunk of the brachial plexus at the level of the erbs point led to the erbs paralysis, and injury to the lower trunk of the brachial plexus leads to the clumpix paralysis. Let's talk about the clinical anatomy regarding certain nerves. If there is irritation to a long thoracic nerve which supplies the serratus anterior muscle, then it leads to winging of scapula, which can be tested by asking a patient to press the hard wall against the resistance. If the middle border and the inferior angle of scapula becomes prominent, then winging of scapula is present. This is all about brachial plexus. Thank you for watching.